Think your cat is just being stoic? One look at their face could save you from a painful bite.
The human face is engineered to broadcast emotion. With a highly mobile brow and flexible mouth, it relies heavily on performative social signaling. The domestic cat's face serves a different evolutionary purpose. It is a precision instrument designed for sensory intake. Because feline expressions lack obvious human analogs, observers often label cats as stoic or enigmatic. In a clinical setting, this misnomer leaves veterinary professionals blind to escalating stress, resulting in preventable injuries. The feline face functions as a biological canvas, a visible surface where the autonomic nervous system provides a real-time readout of the internal state. This map tracks the threat detection pathway. When a cat encounters a stimulus, sensory input is routed to the thalamus, which forwards the data to the amygdala for valence assessment. If a threat is perceived, it signals the hypothalamus to activate the sympathetic nervous system, initiating the fight-or-flight response. This sends signals down the brainstem, engaging cranial nerve 7, which directly innervates the ears, eyes, and muzzle. Visible changes, such as flattened ears or retracted whiskers, are the mechanical results of this neurological cascade. They are involuntary readouts of the limbic system. The exterior facial features act as a continuous monitor, displaying the balance between the sympathetic and parasympathetic nervous systems. Sympathetic dominance drives high arousal. This presents as increased facial muscle tonus, retracted lips, and widened eyelids to expand the visual field. These markers exist for biological preservation. Flattening the ears against the occiput protects the delicate cartilaginous structures from teeth and claws during a potential fight. Parasympathetic dominance is characterized by muscle relaxation. The eyelids droop, the ears swivel loosely, and the whisker pads maintain a soft, rounded profile. The core objective during any veterinary examination is to monitor this autonomic balance as the patient processes the clinical environment. Identifying the precise tipping point, the moment a cat transitions from parasympathetic relaxation into sympathetic arousal, is the primary method for predicting a strike before it occurs. Humans possess 3 rudimentary, often atrophied auricular muscles. A cat possesses 32 individual muscles controlling each pinna. These muscles anchor into the scutchiform cartilage, a small boot-shaped plate at the base of the ear. This allows for 180 degrees of rotation and completely independent movement of each side. While the primary function of this musculature is auditory triangulation, its high visibility makes it an essential communication marker. During the forward alert position, pinnae rotate fully forward. In a confident cat, this indicates curiosity. In a reactive cat, this is the target lock phase preceding an offensive strike. This diagram illustrates the lateral swivel, or airplane ears. Neurologically, this represents a conflict state. The cat rotates ears sideways to monitor sounds from multiple directions. As fear escalates, it enters posterior flattening. Pinnae press against the skull to reduce silhouette, signaling defensive aggression. In a divergent swivel, the ears move asymmetrically. The cat is processing multiple stimuli, creating a distractible state ideal for technician intervention. Because the pinnae require intricate muscular coordination, their rotation serves as the fastest metric for diagnosing shifting emotional thresholds. Vibrissae are specialized tactile hairs rooted in a highly innervated follicle sinus complex. When a vibrissa bends, it pushes blood against the sinus wall, stimulating hundreds of mechanoreceptors. This allows the cat to detect air currents and textural changes as minute as the width of a human hair. During protraction, muscles push the mystacial pad forward, fanning the vibrissae out toward a stimulus. Protraction occurs during harmless investigation, but in high arousal states, it allows the cat to assess the precise distance to a target before a bite. During retraction, the vibrissae are pulled flat against the cheeks to streamline the face and protect the sensory organs during states of fear. Somatic pain causes the bunching phenomenon, used in the feline Grimace scale. Pain causes the mystacial pad to swell, which clumps the vibrissae out of their normal alignment. Because the cat has voluntary control over this complex, The geometry of the moustachial pad provides a readout of their intent to engage or retreat. Eyelid tension and globe exposure are controlled by the orbicularis oculi, the sphincter muscle surrounding the eye. Under parasympathetic control, the lids are heavy and almond-shaped. Sympathetic activation creates a hard eye, pulling the eyelids wide to maximize visual intake. The slow blink is a signal of non-hostility, involving a gradual, deliberate contraction of the orbicularis oculi muscle. Clinicians can mimic this behavior to downregulate a patient's stress response. Mydriasis, or pupil dilation, is a sympathetic response to flood the retina with visual data. In a bright exam room, these saucer eyes are a hallmark of terror. Miosis, or constriction, represents the opposite state. Tight, pinpoint slits indicate intense, offensive, aggressive focus. Pupillary dynamics are also influenced by severe pain or the administration of opioids, which can cause dilation regardless of the environmental context. Misinterpreting a dilated eye as a sign of playfulness rather than maximum sympathetic arousal is a primary cause of clinician injury. The levator labii superioris and masseter muscles dictate the geometric shape of the muzzle and jaw. This comparison shows how stress and pain transform the face. A relaxed cat has a rounded muzzle, while escalating somatic tension alters this geometry, creating an angular, boxy shape and a tightened chin. Within this structure occurs the Flehmen response. It is frequently mistaken for an aggressive snarl. The vomeronasal organ, or Jacobson's organ, is a chemoreceptory structure used to detect pheromones and chemical messengers. To use this organ, the cat must extend the neck, curl the upper lip, and slightly open the mouth. During a Flehmen response, the cat is quiet and immobile. True aggression involves vocalization, pinned ears, and high body tension. Mistaking this olfactory investigation for a threat leads to unnecessary physical restraint, which immediately spikes the patient's stress. Clinical application requires the synthesis of these individual microsignals into a single diagnosis. A single variable, such as a dilated pupil, provides incomplete data and can lead to contradictory interpretations if viewed in isolation. This matrix maps the clinical differences. Dilated pupils paired with flat ears indicate defensive fear. Constricted pupils paired with forward ears indicate offensive confidence. A third state occurs when dilated pupils pair with forward ears. This shifts the diagnosis toward predatory excitement or playfulness. Failing to synthesize these variables leaves the professional guessing, turning standard examinations into a game of neurological roulette. This diagnostic framework can be applied to a 4-year-old patient huddled at the back of a carrier. The first data point shows the pinny rotated laterally into the airplane position, indicating conflict and acoustic monitoring. The ocular data shows the orbicularis oculi pulled wide and pupils exhibiting severe mydriasis. The muzzle data shows Vibrissae retracted flat against the cheeks and masseter tension creating a boxy geometry. This specific cluster of signals proves the patient is at maximum sympathetic arousal and experiencing extreme fear. The visual readout requires the clinician to abort standard handling. This patient requires fear-free extraction techniques or chemical restraint via gabapentin for a future visit. Mastering the micro-signals of the biological canvas allows the clinician to anticipate feline behavior with clinical precision, ensuring the safety of both patient and provider.
Learn to read the feline face like a pro. Like, comment your biggest takeaway, and subscribe for more fear-free vet tips.